I want your calls on this, especially if you've got personal experience. Should the House of Lords block the assisted dying bill? The number is 0207 862 2222. Please get your calls in now. Now, you'll know because you have watched it last week, MPs voted to approve the legislation on Friday with a slim majority of just 23 MPs. It would allow terminally ill adults in England and Wales with fewer than 6 months to live to apply for an assisted death, subject to approval by 2 doctors and a panel. That panel would feature a social worker, a senior legal figure and a psychiatrist. It's now up to the House of Lords to scrutinise the bill, and the first step could happen this week. If it passes through smoothly, it could become law by the end of the year, though even then it would take a further 4 years before anyone would actually be allowed to be offered the service. But it may not go smoothly because the Lords could keep voting it down or introducing amendments which would delay the process. But if the government really wanted to, they could reintroduce the bill, which was introduced by backbencher Kim Ledbetter. As government legislation, it could pass it without the Lords' approval. Now, you've been very clear about your view, Anne.
Yes.
Just help us. What is it? Should the Lords stop this or not?
By the way, when you say they could pass it without the Lords' approval, if they passed it as a government bill, it would still have to be delayed by a year.
Right.
And that's just necessary to make that point.
Yes.
I know it's a complicated process. No, my view has always been, in principle, I've never had a problem with people saying that if they're terminally and very painfully ill, that they should be able to bring about a premature end to it. But equally, I have never yet, in all my time in Parliament and now, and through previous attempts at this, seen any legislation which convinced me that the safeguards were adequate. Because, of course, there are 2 lots of people concerned. There are those who are dying, and there are those who potentially could be coerced by themselves even. You know, they feel they're a burden. There are specific groups like anorexics, for example. A lot of people not protected by this bill. And so I am not convinced that the safeguards are adequate. Michael, I actually reckon they probably wouldn't be, but I was prepared to give it a whirl.
Oh, really? Michael?
I've found this a really difficult debate, and it's one where people I respect feel very strongly on both sides.
Yep.
So I can totally see the argument for and against. In general, my guiding principle is I'm in favour of choice. And I do think it is, you know, when someone has gone through that decision and then they are under suspicion by the police, obviously I'm talking about the partner here, I think that does probably compound the pain of already a difficult experience, which is why I err on favour of, I'm in support of this legislation, but I do see all of the arguments against.
On that point, on the criminalisation of partners that see their loved one dying, we're joined now by Louise Shackleton, who accompanied her husband, Anthony, to Dignitas in Switzerland in December. She then surrendered herself to the police, and an investigation is still ongoing. Louise, thank you for being here and sharing your story. Just tell us, if you can, about Anthony. What happened to him, and how did you end up going to Switzerland with him?
Okay, so in 2018, he was diagnosed with motor neuron disease. He was actually one of the lucky ones with regards to the disease because he lasted 6 years. And may I just add that the law as it stands at the moment actually was the law that coerced him into going to Dignitas, in the form of he had to be able to travel there.
Right.
He had to have somebody to take him there because he couldn't have made it on his own. So he went and he died prematurely. If this law had have been in place here and now, my husband would still be alive today.
Can you help me understand that more? So people at home need to understand it. Just basically, you've surrendered yourself to the police, but what you say is that he had to be able to take himself there in order for him not to be, or you not to be, committing a criminal offence. Just help us understand that, if you can.
Oh, okay. So I have committed a criminal offence by simply pushing him onto the plane. I mean, he made all his arrangements, even repatriation of his body, he made all of those arrangements himself. I simply knew what he was wanting, knew what his choice was. I pushed him onto the plane and I enabled him to get to Switzerland. So I am under police investigation. In fact, I've just heard this morning that my case is now with the Crown Prosecution, and I believe will go on to the Department of Public Prosecution for scrutiny.
Just help us, Louise, when Anthony came to that decision, I mean, what sort of conversations did you have, and how did you feel once he'd made that determination to end his life?
Well, first of all, I need to make it really, really clear about the statistics about people with terminal illnesses killing themselves at home in unorthodox means, cruel and horrible, grotesque means. So the Lancet had published that over a cohort of 47 million, that 27% of people within the first year of diagnosis or the first rollout of treatment actually kill themselves at home, unregistered, unregulated, unsafeguarded.
Louise, can I come back to something you said before, which is that, if the law had been changed, as you know, MPs voted for assisted dying, albeit narrowly, Anthony would still be with us. Now, just if you can, just help us understand that a little bit more. Do you mean he would have stayed in this country and waited a little bit longer with you? How do you feel about that?
I'm angry. The law as it stands killed my husband. There's no ifs or buts about that. The law as it stands killed my husband. I actually, law-wise, I don't care what happens to me because, the worst thing in my life has happened. My husband died peacefully in my arms, but he died, and he died sooner than he should have died.
So he would have done it here? Is that the sort of point you're making?
If this law was in place, he would have taken that. He would have played Russian roulette with that, and he would have taken that. We actually were looking at moving up to Scotland, selling our house and moving up to Scotland, because he actually thought that law was going to be brought in sooner. Sadly, it hasn't been, and they're a little bit behind Westminster, but yeah.
Now, I wonder, there are people out there, we're going to come to the panel in a second, that, are really worried about this. And you'll understand why, because they worry that, perhaps unlike Anthony, there are not necessarily the safeguards in place, and that people might feel a burden onto their family or any other number of reasons, which you'll be aware of. What's your message to those, perhaps in memory of Anthony and the choice he made, who are really worried about this legislation?
Okay, so Anne's just recently gone on the normal rhetoric of scaremongering and using the word anorexia. Well, anorexia is a mental illness that can be treated. It's not a terminal illness. People with anorexia, the elderly, the disabled are not applicable to this bill unless they have a terminal illness with only 6 months to live. We need to really be getting that straight. The scaremongering, and I heard it from MPs, in chambers on Friday, saying it time and time again. And it made me actually wonder if they've actually read the bill and actually the constraints with the bill.
Well, thank you very much, Louise. We're going to keep you here to listen in to the callers, and we'll follow intently what the Crown Prosecution and eventually the Director of Public Prosecutions does with your case. But just being mindful that you are under criminal investigation for taking your husband to Switzerland. Janet, you're in Norfolk. What do you make of what Louise has just said?
I do agree with what Louise has just said. I don't think that the Lord should block the bill. I think the bill should go through. And my reason is that in hospitals at the moment, doctors and nurses are already assisting people who are terminally ill to die. And the way that they're doing it is withdrawing food and water. Mm-hmm. My brother was in hospital in 2024 with a terminal illness, and he was in agony with his tongue sticking to his mouth, because the way that they were dealing with it is to withdraw food and water.
You're talking perhaps about the Liverpool pathway, as it's called.
Yes, but they're calling it the Swan pathway.
I see.
But it's exactly the same.
Right,
I wrote and complained to the hospitals.
Yeah.
and they're just calling it a different name, but using exactly the same procedure.
You say, Janet, that this is more humane. Just to be clear, one of the amendments, I'm going to come to you, Glenn, in Devon, is that in this legislation, is it would allow doctors and nurses who did not want to participate in this to be able to do that without there being any threat to their professional qualification at all. And that's actually baked into the legislation. Glenn, in Devon, what do you think here? I mean, should the Lords be able to, as we say, usurp the will of the democratically elected chamber who have said, yeah, you know, thing is, that's how Parliament works. This is the view of the people.
I think it should be the view of the people, if they want to die and there's no way to cure or anything like that, it should be let them die. My mum died of motor neurones disease. Not only the suffering what she was going through, the whole family was suffering, going up there every day, every night. My dad seeing me dad crying, it brought his health down, and my mum literally wanted to die anyway. And of course there was no assisted dying. She managed, she couldn't eat no food, couldn't swallow, and it's a terrible disease, and there was no chance of a cure or whatever.
So you would support you would support this legislation as it being entirely humane. One of the challenges, of course. Thank you so much for sharing your stories, Glenn. I'll come to you, Pauline, in the West Midlands. One of the challenges here, if you've got a disease like that, is the extent to which it comes to a point where you're able to give consent, which of course makes the whole thing very legally difficult, especially if you have to wait to go and see a 3-person panel. Which makes it practically difficult, I would have thought, by the time you reach your end of life and you're ready to make that application to pull the trigger, so to speak. Pauline, in West Midlands, what do you think?
Hello, Rob. I am very concerned about this bill. I believe that the assisted dying assessors will not meet the patient in person who could be depressed or scared and better off with counselling. A patient could use assisted dying without consulting their family or telling them. A patient without pain could choose to do it due to the 6-month terminal illness rule. No one will tell them they would be better off alive because paternalistic care from society is gone and suicide prevention too. Hospices and care homes who do not want to provide a suicide treatment service will be coerced into offering it. Doctors will be breaking the Hippocratic oath of doing no harm to the patient. And
Pauline, just as I said, baked into the legislation, there was an amendment that was voted through saying, look, any doctor or nurse that didn't want to take part in this wouldn't have to. Does that not perhaps stop some of your worries about this?
Doesn't.
No, because disabled and vulnerable and elderly patients are already fearful of the expected cultural change within society, that it will be offered to them as a treatment instead of care. Patients, after discussion with a doctor, could feel pressurised into doing it due to a lack of hospices and alternative treatment. And I'm concerned that doctors will not have the time in order to give the full arguments for and against assisted dying, because they will not have the time to show the patient, well, here's what the alternative is like. Here is the palliative care which you could have.
I hear you, Pauline, and you make your points, I have to say, very powerfully. One of the responses is that this panel would be perhaps asking the patient whether or not they've considered all of these things, and that will be discussed in the House of Lords. The question is, I suppose, the extent to which the House of Lords delay this bill. It's not going to be available at least for another 4 years. We watch this space, and I have to say I'm really grateful for everybody phoning in with courage and openness to share their stories. It's a difficult one, and it's why it's an open debate across party lines. Pauline, thank you very much for calling later.